No, this was. I don't know when the last time I talked. I don't know who to get a hold of. Mine. About trying to switch.
Oh, we've got a lot of our staff that's still looking for at least 4 more board members. Debbie?
I think it's okay.
Yeah.
She didn't say hi to me. I tried to say hi.
Carrie, can you hear me?
Yeah, can you hear me?
Yes. I just
Okay.
wanted to let you know that Cindy Chicker had emailed and she will not be able to make the meeting today.
Okay. We still have a quorum with Brad being gone?
We need 4. So
Okay.
it looks like I see 4 faces of board members, it looks like, so we're good.
Trying to get in here on my home computer and I'm having problems.
You okay?
Yeah. All right,
All right,
so
so
do
do we have all 4 people that need to be here?
It appears that we have 4 of the Health and Human Services board members. So Dr. Barrett,
okay.
Dan Nelson, Debbie Kaiser, and yourself.
All right. Well, I'm going to go ahead and call this meeting to order. So was there proof of posting,
Yes.
public notice? Okay. Then I would entertain a motion from the committee members to approve our 16-point agenda.
This is Van, I move.
Motion by Supervisor Nelson. Is there a second?
I second that, Debbie Kaiser.
Seconded by Debbie Kaiser. Is there any further discussion? Hearing none, all those in favor signify by saying aye.
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 Opposed? Motion carried. Moving on to approve our minutes from the January 14th, 2021 Health and Human Services. Is there any additions or corrections to these minutes? Hearing no additions or corrections, I'm going to declare that those minutes be approved. Move on to agenda item number 3, citizen comments. Is there any citizen comments? All right, hearing no citizen comments, we'll move on to our director's report, agenda item number 4. Tracy, you want to go ahead?
Yep, thank you. All right, so the community services building remains closed to the public. In order to continue to minimize exposure to consumers and staff, we intend to remain closed until all of our staff have been offered an opportunity to receive the COVID-19 vaccine. Delivery of services primarily through virtual means continues to be going pretty well. Individuals are able to access services, and although it's not ideal, it's working. Staff are providing in-person services when necessary and appropriate. Minimizing contact continues to be the best way to keep our staff and our consumers safe. We'll continue to provide services by these virtual means as much as possible, with in-person services being provided only when necessary. All staff meetings will continue to be held via video conferencing. About 75% of our staff work remotely, either full-time or part-time. That's continued as it has been. Fortunately, our Health and Human Services staff have remained safe from the virus. Since we closed last November, no staff have tested positive, and only 1 or 2 have had to remain home due to an exposure or while waiting for test results. Approximately 48% of our 96 Health and Human Services staff and volunteers have now been vaccinated. The remaining Health and Human Services staff may become eligible for the vaccine in March, but this will depend on the supply and the state giving the go-ahead. The public health emergency continues to influence the operations of the economic support programs. Normally, food share requires interviews when someone applies for or renews their benefit, but due to the pandemic, interviews are waived until June 30th of this year. Requirements to conduct renewals had been waived for all of last year, but will now need to be completed. The Richland Economic Support Specialist will assist the Capital Consortium with conducting approximately 3,500 renewals. Badger Care and Medicaid recipients continue to remain eligible even if they report a change that would normally make them ineligible for the program. Medical programs will also continue to have premiums waived and renewals extended. You may have heard that President Biden signed an executive order that reopened the federally facilitated marketplace for special enrollment period that will last from February 15th to May 15th. This will allow more access to health insurance for those who don't have it through their work or other means. And finally, as of February 3rd, the Wisconsin Home Energy Assistance Program has assisted 607 households with their heating bills. We continue to assist households with preventative assistance as well, so be sure to refer individuals if you know they are getting behind on their utility bills. We're also able to help with LP fills. Many households find that by this time of year, their credit has been used up and they may need help with a midwinter fill. Our ADRC has created a survey for the upcoming 3-year aging plan for the 2022 to 2024 period. The Commission on Aging and Disability Committee approved the survey in December. It was published in the January newsletter. It will also be available on our ADRC webpage, the agency Facebook page, and it will be published in local newspapers. In addition, the survey has been sent out to local libraries to post on their websites. We're looking into hosting virtual listening sessions and are tentatively planning scheduling in-person sessions at local apartment complexes and libraries for later this spring if it's safe to do so. In child and youth services, child abuse reports and referrals about child welfare continue to be down. Because of this, our child and youth services staff have continued to focus on preventative outreach to families, especially those who are struggling with the virtual education requirements. Behavioral health services, the coordinating committee for CST, or Coordinated Services Team, met on January 20th. The committee reviewed the 2021 CST budget and the current enrollment status for youth who are receiving those services. Currently, a total of 28 children and their families are receiving CCS, CST using the Coordinated Services Team model. There are also 28 adults receiving services in CCS. Our staff will be providing new provider training for CCS contract vendors this week on behalf of our 3-county Wisconsin River CCS collaborative. CCS contract providers need to complete required training to be qualified providers for psychosocial rehabilitation for individuals who are enrolled in CCS. Presently, there are 74 CCS contracted staff that work with our CCS consumers in Richland County. And finally, our substance use treatment team staff continue to provide, continue to participate on the Richland County Child and Family Advocacy Council. Substance abuse counselor Kyla Luther was recently appointed to be the chair of the council's prescription drug work group, which is working with the local prescribers and community stakeholders to prevent prescription drug misuse by youth. And that's all I have for my report. Are there any questions?
Any questions for Tracy? All right, hearing no questions, we'll move on to our health officer update. Rose?
Hello, good morning. While we still remain busy here in Richland County with COVID-related cases and exposures, we have definitely been switching our focus to vaccine administration. And I'm happy to report that based upon the activity that our public health staff have been engaging in, we've actually administered 222 dosages of COVID-19 vaccine to individuals who have scheduled themselves for our clinics at the community/senior center here in Richland County. I did want to give you some statistics that are Richland County specific. The Department of Health Services has added an additional level of detail to their county specific data. And I wanted to let you know that some of this data was just posted yesterday and today, that at this time, 14.8% of Richland County residents who are eligible have received their COVID-19 vaccines. And that's at least an initial vaccine. And that would amount to 2,561 individuals. 3.6% or 619 residents have completed the series already. And as of the week of January 31st, 1,091 vaccines were provided. As of this week, of course, we've only got data for just a few days already. 296 vaccines had been tallied, and those do not include the vaccines that Public Health provided yesterday during our clinic. And based upon the statistics, which have further been broken down by age group, as of the publishing of this data, those 65 and over would comprise 41.9% of those who have received vaccines. So that's really good news. When we take a look at a fairly large or substantial age group here in Richland County, to know that 41.9% have already received vaccines. So that's really good to see. And again, primarily Pfizer is being administered through the public health office, through the Richland Hospital, and then through Center Pharmacy. We kind of collaborate for distribution of that vaccine. And then those entities such as skilled nursing facilities and long-term care facilities have been receiving Moderna for the most part. It depends on whether or not a long-term care facility such as an adult family home, CBRF, or RCAC and the like agreed to participate in the pharmacy partnership program. But by and large, those folks will have received Moderna vaccine. And we're getting to the point where we're boosting more and more individuals. So that 3 and 4 week period of time is elapsing for both the Pfizer and Moderna vaccine. So it's just a really great effort, and we're hoping to continue on in that vein. And as soon as we can be more assured of a rather steady vaccine supply, we're looking at increasing the numbers of individuals that we serve at any of our clinic sites here through the public health office.
Are there any questions for Rose?
How many cases do you have now?
How many cases do we have right now? I believe
Yeah.
the information I saw this morning indicated that we have 60 active cases. Of course, we need to reconcile that with some of the cases that will be released here in the next day or so. We usually update some of the data daily, and then some of it gets updated weekly when we have our Emergency Operations Center briefing. But based upon, if I recall correctly, I think we had 60 cases that were active.
Are there any other questions? So I received my second dose of the vaccine, and I had Moderna, and I got kind of ill from it. I got body aches, and I got chills and a headache, and I was whooped for probably about 12 hours. Then it just went away. All right. If there's no other questions, we will move on to agenda item number 6. Consider a public health advisory recommendation. Would this be from finance and personnel, or?
No, Mr. Chair, this was put on the agenda following a couple of meetings between Rose and Emergency Management, our county administrator, and the county board chair. There was some question about whether or not Rose, as our public health officer, might recommend some sort of mask advisory. Since the governor did issue that advisory statewide, that group met a second time and discussed really maybe it's better that we try to promote mask wearing through just advertising and public campaign rather than issue any specific advisory. So I think if I'm kind of speaking for Rose, so please jump in, Rose, if there's anything to add. But I think what we're really asking is to remove this from the agenda and not address it at this time.
I'm fine with that. I know Sean Murphy-Lopez, Supervisor Murphy-Lopez called me and wanted this put on the agenda, and I think Linda was part of that discussion also. That's why I thought it'd come from finance and personnel.
Yep.
And Debbie,
All right.
Yeah, and Debbie, I want to make sure that you know that we have 50 active cases. I looked too quickly at the statistics I saw this morning, so it's not 60, it's 50. So please forgive me for that misinterpretation of the information.
Thank you.
All right. Move on to agenda item number 7, review and approve Health and Human Services vouchers.
All right, can y'all hear me?
Yeah.
Great. Okay, so we have $30,983.60 worth of vouchers this month, split between some 2020 stuff and some 2021 items. Going to the first page through the second page, those are the monthly mileage expenses for transportation program. Moving to page 3. The notable one on this page is the very first one, to card member services for $669.71. This is for more frozen meal containers for the nutrition program. This carries through to our credit card bill for the total at the bottom of the page of $3,103.69. Most of the other items are routine expenses. The Cario credit card, or the credit card bill is split between 2020 vouchers and 2021 vouchers. There's an additional about $120 on the next page for the credit card bill. So we'll actually move to the next page, to page 4. Midway down the page, I'm kind of skip around a little bit. Number 3, that's the rest of the credit card bills. Those 3 charges there. That's the last one. So I just wanted to highlight that that's the rest of the credit card bill. Going up to bouncing back up to line number 6, the second one down. We had a hefty snow plowing bill for January. Not probably a surprise to anyone with all the snow we got, but that's our bill came through for that. Moving to page 5. Right down the middle of the page, number 16. We had a small Richland Observer bill, but notable this month. And this was for an ADRC ad. Moving to page 6. For a total of $70. It was actually $35 from the other page and $35 on this page. It's for 2 staff to have membership in the Wisconsin Association of Benefit Specialists. Moving to page 7. These are the prepaid vouchers for 2020. Line number 3 to Bear Graphics for $648.64. These were for some receipt books to receipt any payments up front. And then line 5. Line 4, sorry, Bindle Snow Plowing. This was for December snowplow services. And the line right below that, Henick for $971. These are release of information forms for the behavioral health unit mostly, but other units as well, children's unit. And then wanted to note line 8 for $1,000 to Richland School District. This was paying, actually it wasn't, it's reimbursing the school district, but it was paying, I forget which vendor. I can look it up. I think it's one of the local computer places, but they're developing a website for the AOTA program to, the website is for developing a drug-free community website. So that's all I had a note on that page. And then the rest is just, the last page is just routine monthly bills. So nothing to note there. Anyone have any questions?
I guess that's not kind of pretending or with their vouchers here, but are we having adequate snow removal, and is that going good this year with the new provider?
Yeah, I would say
Tracy?
the first time, or maybe even the second time, we had to kind of show them some things that they needed to do a little bit better, but ever since then, I think it's been pretty good.
Okay.
I have a question. Can you guys hear me?
Yes.
Okay, my mic yesterday was giving me trouble, so if it goes out, let me know. I was just wondering, I know with the new vendor, is this pricing, I can't remember exactly what the bids were that you got originally, but is this about normal for this time of year? The amount that we're paying for the snow removal?
Angie may be able to address that.
We usually budget about 6,000 a year. That includes October, November, December of, so if you think about it that way, it's carries over from one year to the next. So, is it ideal? No, that we've already spent over $2,000 in 1 month. When we still, I'm sure February is going to be a pretty hefty bill too, but we just hope things get a little better come March, and then we've got a little bit of money left over of that 6,000 for if anything happens in November or December of this year. So, it's not awful, but it is definitely higher than some years. But some years we have $10,000 in bills too. So it always just kind of depends. But definitely, I will say the pricing was very similar to what we had in the past.
Is he pretty consistent with that billing
Yes.
compared to what he put his bid out for? Okay.
Yeah. Everything's matching just fine. It's just, it depends how much snow you get and how much they have to remove. I know they're coming more during the day to remove the snow piles, which I was a little concerned about because they're trying to use that equipment of theirs while we've got staff cars in the parking lot. So I was a little nervous about that. I kind of watch and observe as that happens, because it used to be that the previous provider would come on nights and weekends. Of course, you pay a little bit more for that service as well. So I think they're doing just fine. It'll be interesting to see if the $6,000 budgeted is able to ride out this entire year.
Well, I like snow, so it can snow a couple more times.
Oh,
Are there any further discussions on our vouchers? Then I would entertain a motion for approval. Is there a motion?
Motion to approval.
Okay, we got a motion by Debbie Kaiser, and I believe Dr. Barris would like to
Yep.
second that.
I'll second it. Yep.
Is there any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Opposed? Motion carried. Move on to our 2020 budget summary, our county placement.
Tracy, can you flip to last month's first,
Oh, yes.
the corrected one?
Yeah, I'm sorry, I didn't bring that up. Let me grab that.
Nope, no problem.
All right, can you see that?
Yep. This is the initial one. Did I put the wrong one out there?
Make sure I'm in the right folder.
That's the one I presented on last month. There should be one that says January corrected.
Oh, mine, yep.
So you can see what the total was last month, 188,000, our bottom line, 974. Actually, it's not bad to start with that one. And then it's corrected to 279,974. When going through this month's, I realized that on the anticipated expense line, that 946,000 in the middle table, I had estimated VistaCares in that total, and I had estimated all of the VistaCare expenses, which right now part of VistaCare is coming out of the placement fund. So I overestimated expenses by $91,000. So we made a correction on that. VistaCare is our very costly placement. So I made a correction on that.
So normally, just to add to what Robin is saying, normally CCS expenses all stay in our core budget, Fund 56, except for the Vista Care placement was put in Fund 54 because it's primarily a placement expense until we can see how much reimbursement we will receive through Medicaid for that.
Yep, thanks, Tracy. So that was corrected. Now we can move to 2021 or 2020 through the current month. Sorry, not 2021 yet. We're still presenting this month, I think, on 2020, next month on 2020, and then we'll be flipping to 2021. So this is as of the end of January. So just going through the typical utilization, there's nothing new that stands out from previous months. But we're pretty close, I would say, as in you can see the anticipated expenses side, there's still some expenses and revenue to come in. Not a lot, we've got most of it wrapped up. So we're pretty solid, getting pretty solid in our numbers. But building and operations budget was underutilized at 78.5%. That was partially because the routes to recovery funding covered some of our IT expenses that we were able to charge some things to the funding, so we didn't spend our normal budget. There were other things that also our workers' comp and liability came under budget by $12,000. So just some other things sort of led to that unspent or underutilized for the building and operations. So just going down then to nutrition at 91.7. I would say not having the sites open probably led to the meal sites to being not spending the full budget. Transportation program under elderly services is at 83.8, and with not having as many trips and whatnot, we have lower expenses, but we also have lower revenue. Moving down to CPS Contractual Services at 89.7. This is based mostly our kinship program, and this year it's a variable cost every year depending on how many families we have. So basically we get the revenue to cover the expenses, so we're okay with that. Then down under the behavioral health, AOTA, outpatient, as well as APS are underutilized, and it's the typical what I've mentioned for several months now is having unfilled positions. And then the last one, children with disabilities at 64.8, we just have less kids in that program. And what actually, when I skipped one more thing I want to note on the CCS line, it shows we're at 90%. We have 1 month's bills still to come through. So I would say we're going to be 100% utilized once that happens. Any questions on that? Okay, I'll move forward to the middle table. The first thing I wanted to mention was as we talk about the core budget and any year-end balance at the core budget being able to go back to the general fund, I made it a slight change to this report in that if you can see at the top of that middle table, it's funds 53, 56, 59. So it's just giving a little bit more transparency to this report in that funds 53, 56, and 59 are funds that do actually go back to the core budget. And as you can see, the bottom two yellow totals, the fund, I don't know if you can highlight them, Tracy, so you can follow where I'm going, the bottom two there. I broke those out of the upper table because the way those funds work, they do not go back to the general fund. Fund 34 is for grants for public health, and that carries over that balance year to year. And then Fund 63 per statutes has to go back to Fund 18 to reinvest in the transportation program. So that also doesn't go back to the general fund. So I wanted to break them out so it's more clear when we're doing this process, what funds actually do go back to the general fund. So then starting at the top, the anticipated revenue, and you can see the anticipated expenses are getting lower. We've almost wrapped up the budget for the year. Without those chargebacks happening, you can see what the deficit of 236,428. The chargebacks are going to happen. They haven't happened yet over in the clerk's office, but I've got confirmation from our auditors that if they don't happen, they will make journal entries at the end of the year to make them happen. So that's really good to hear, because then things appear accurate on our books, like what shows up in our core budget versus the placement funds. As you can see though, it's not a mistake. The Mental Health Institute charges through December are that 700,008, and then the chargeback under the chargeback table through November is 636,063. That number is different than the number above because our December Winnebago charge, our CARS bill, basically our allocations for in December were less than our Winnebago charge. So they're going to take our Winnebago overage likely out of our January 2021 CARS allocations, which isn't how I hope things would happen for the year. So basically that 636,063 is what is going to hit our 2020 books for being able to charge back to the placement fund, unless the auditors can do something different. So just noting then, below funds 34 that I mentioned has a carryover, expected carryover balance of 4,216, and fund 63, the 39,684. Then looking at our year end, after all the transfers happened that would go back to the general fund, it's 399,635. And then we'll move to, I want to give a write-up or description of sort of what has led to this year's having the year-end balance that we have right now, and explaining a little more on that. So you guys can all see the sheet Tracy brought up, the 2020 explanation of our year-end balance. So we have the child care program under the economic support unit. We budget that revenue every year, and we haven't had expenses to go with it. And for the 2021 budget, we have included expenses to go back to cover that, to go to that revenue. So the WIMCR settlement for 2018, the WIMCR program conducted, they called it a desk review audit. It's more like, I guess, a mini audit, I would say, on our 2018 WIMCR, and the $70,000 was a result of that desk review that we received. This doesn't occur annually, so we didn't have a plan to spend that, but that won't happen again for 2021. It may happen again sometime in the future, but we're not sure when. The WIMCR settlement for 2019, we received $41,000. We've actually put revenue in the budget that we're counting on for 2020 settlement, so that is actually now in the budget to plan to cover our expenses. The Medicaid reimbursements, we also included that additional revenue received in the budget planning for 2021. Now that we understand WIMCR process in the CCS program more, we've had done a lot of extra planning to predict what those numbers are going to be. So we've actually included that as well in the budget for 2021. And the economic support unit, additional overhead reimbursement were received. We received additional money in 2020 for an enhanced payment. Pardon me? I thought I heard somebody talk. But we have it budgeted for that enhanced payment in 2021 in the revenue. And this is they say it's a variable amount every year, or the amount has been different every year. And we are told that we necessarily can't count on that money, but we have planned our budget around getting it, because it's been, even though they have told us that, we have received that payment for 3 or 4 years in a row now. And so it's seeming like it's more of a solid funding to us. And then we underspent the building operations budget, as I mentioned in the table earlier. And that was partially due to the routes to recovery funding covering technology expenses and maintenance and whatnot that we would have had to fund out of the building operations budget otherwise. So sort of giving you a picture of what has led to the year-end balance this year, and yeah, explaining that we've built that into the budget for already for 2021.
Just to reiterate what Robin is saying, and we didn't think we would have such a large year-end balance of this year, and I think we wanted to make sure you understood the factors that contributed to that, and why we don't believe that that will continue, especially because we had to make that $120,000 cut in our tax levy for our 2021 budget. We've been kind of pushed to make sure that we decide what we think we can count on of these types of funds going forward. And I think also with both my experience and Robin's experience, now kind of having 2 years of this under the belt, I think we feel more confident in what we will receive in those types of funding sources. So I think we're feeling solid on expecting to receive those, and so we've built it into how our budget is for 2021.
Correct. So if no questions on that, then Tracy can move forward to talking about placements.
Can you just remind me again, what does WMCR stand for?
Sure. It's Wisconsin Medicaid Costs, what is it? Reporting. I wanted to say reconciliation. I knew that was not right. So it's the Medicaid cost reconciliation that we do in order to get more reimbursement for our actual costs, not just the Medicaid billing that we do.
Thank you.
All right, if it's all right, I'll just move on then. I want to note that we put in a corrected placement report in your folders. So I just want to make sure that you've got the one that says corrected on it. And I'll explain what the correction was that we did as I get to it. So for Fund 54, which is the adult fund, placement fund, for adult institutional and inpatient placements, our expenses stayed pretty high in December, pretty comparable to November. The adult crisis stabilization total for the year, I think we have all of the bills for our placements now, as far as I understand. So this may be your last placement report for 2020. So adult crisis stabilization ended at 41,876. Adult institutional expenses ended at 872,635. Community residential placements ended at 267,343. You'll note in December that there's a $206,000 reimbursement there. That is CCS Medicaid reimbursement that we've moved into the placement fund to help address the costs of that high cost CCS placement that we have. So that was the change, that was the correction that we made to the placement report here. So again, Fund 54, we began the year with 482,278. We had a total of 1,181,854 in expenses applied to the placement fund. And so that leaves Fund 54 with a deficit of 699,576. I'll move on to the child placement fund, which is Fund 44. The child institutional and inpatient and detention placements continue to be pretty steady in terms of expenses in December, as it has been all throughout the year. Our child institutional expenses ended the year with $238,082. The year-end detention costs was $51,675. And then with the community placements, child foster care and treatment foster care, the group home treatment foster care ended the year at $222,711. And regular foster care ended the year at $29,464.
Tracy, this is Rose. If you go back up to the other placement report, it looks as if for detention costs, it looks as if we added the reimbursement rather than subtracting it.
Oh, thank you for catching that, Rose.
Thanks.
Yes, I guess we'll have another corrected report to share with you. That's a good catch. So you can see here, the cost of stay was $49,875. There were reimbursements of $1,800, and that should have subtracted rather than added. So it would be less than the 49,000. So we will have to correct the math on that. So this isn't entirely accurate. We're off by about $1,800 then, but the Fund 54 beginning balance was $527,341. The total expenses, except for that $1,800, was $541,932, and that would leave Fund 44 with a deficit of $14,591. So I'll just kind of share with you what that looks like for the year end. So this table shows you, again, at the top is a graph showing you the historical information on placement costs. We ended the year with a total of $1,723,786, with needing to add in that correction. So that would mean that the projected shortfall for the placement fund is $714,167. So as Robin pointed out, right now she's projecting about 399,000 funds remaining in our core budget. It will be up to the finance committee. Those funds would automatically go back to the general fund. So the finance committee would have to decide if, well, they'll have to utilize some funds to cover this shortfall, unfortunately. And the reminder from 2019, Health and Human Services returned $551,952 back to the general fund, which the finance committee did not want to just transfer into the placements, because they really, I think the discussion was that they wanted to make sure that they highlighted what the actual expenses to the placement fund were, and transferring those funds immediately. Sometimes it doesn't necessarily keep that expense in front of everybody. Does anybody have any questions on that?
Tracy, over the course of a year, how many individuals does this include?
So let me kind of go back. I don't know if I can do the quick calculation, but I can show you where the numbers are.
A rough estimate.
So for each of these, so the crisis stabilization was 7 individuals for the whole year, 23 for adult institutions. So there we've got 30. Now, know when we switch from one placement type to another, one person may have moved from one of those to another. So by adding all this up, we might be double counting because if a person moved from institutional placement into a community placement, they'll be counted in 2 different places. Of adults, it looks like we've got 33 individuals counted, but I would say that there's a little bit of duplication there. And then for children, we have a total of 4 children accounting for the institutional and 2 for detention, so that's 6. And 10 foster care and 9 treatment foster care, so that'd be 19, so 25 total individuals counted. But again, there would be a little bit of overlap as an individual might have passed through one placement to the next. I can certainly come back next month to tell you the actual total of people so that we aren't double counting anybody.
No, I don't need the exact number, but we're talking maybe 50 to 60 individuals costing $1.7 million for the county.
That's correct.
And we're one of the smallest counties in the state as
Yeah,
far as population.
yeah. Now we
How
did
is-
have, oh, go ahead, please.
How is this going to be sustainable? I mean, we're using the majority of our budget for placements on a few individuals.
Yeah. So that's a very fair question. The biggest part of those expenses falls here in the adult institutional placements because that's the highest cost. So 872,000 of those costs are there, accounting for about 23 individuals, or maybe roughly half of the number of people that we're talking about. I guess the best I can say is this: we think this year was an exceptionally high year in placement costs. It's the highest year that we've seen. When I showed you that graph of historical, that this was the highest number. If this were to continue, it's not sustainable. That we have to find alternatives, ways that we can keep people in the community. That's certainly a reason that I've been advocating for trying to make sure that we have sufficient mental health services here in the community, that we utilize CCS as much as possible, that we need to maintain our staff so that they can develop that expertise and those skills so that they can help people function and live in the community as effectively as possible, and that we can intervene before we need to go to something like an institutional placement. But it's certainly an understandable thing to be concerned with. I think it worries me too.
Tracy, could we have at some point a report or just maybe some information on how that's going with the CCS? I know that was kind of a big push to get another position there, to get more places with that. Could we have some information on how that's going? How that basically looks numbers wise as well? Just some data on that, I guess.
Sure. We can certainly take a look at how to get that information to you. And you're right, that has been, you know, a big argument from, I guess, in favor of adding some positions, not just CCS, like that APS and crisis position that was added. That was a large part of the rationale for creating that position, is making sure that we have that ability to respond to those kinds of emergencies here. So yeah, I think we can look at a good way to give you that information.
Great, thank you. I'd appreciate that.
Are there any further questions for Tracy? If not, Angie, you're on deck here.
Yeah.
You go to agenda item number 9, the contract monitoring report.
There it is. Can you go take me to page 1 though, Tracy?
Oh,
That's page 3. That's okay. There it is. Okay, so here we go. So it's kind of, February is kind of an interesting month in that I am seeing some bills already on the county checkbook for 2021, but most of our vendors are just finishing up 2020. So I'm not exactly sure what I'll be able to offer next month, because I like to see in February or March where they're making that transition. You've already seen everything from December 2020, and now there's bills already starting for 2021. And I didn't see that when I did the contract monitoring. So I'm guessing we're going to have one more cycle of December invoices. A few of the providers, you'll see most of them, I've got December current month invoiced listed, but I maybe didn't see then a January 2021 bill yet. So if I see those in March when I'm back in looking for this report next month, then I'll prepare a report for 2021. Otherwise, I might just do one more to close out 2020. The auditors will need that. They'll need final numbers, as well as this report is what they look at too. So, so looking on page 1, this is obviously for 2020. Everyone on this page is invoiced through December, and on the far right-hand side, the percentage utilized should be under 100%, which these all are, but you can see there's still a little bit of wiggle room for some of these vendors if they do submit some additional bills yet for 2020. So page 2. Page 2 also, everyone, I saw bills in there for December, but there is a lot of wiggle room. Again, on the right-hand side, the percentage utilized is well under the 100%. And page 3 is where we start to see some that are overutilized. And so these will be yep, right there, Tracy, right in the middle. Premier Financial Management Services is a children's long-term support pass-through that they do the financial management. So I will have to talk to Lori about if these are final bills, or if we need to look at increasing that even more over the $156,000 that they've already spent. So that is one that I've pulled to work with Lori on and see where we're at with that one. Then just a couple up from the bottom, a Golden Star Adult Family Home was slightly over the 100% utilization. They spent another $778 over the contract allotment. So that would be an adult family home that I'll be working with Miranda on if all the final bills are in, and if that increased dollar amount of maybe $51,000 is going to be enough or not. I'm not sure if they've put another person in there in late 2020 that would have tipped that over the approved contract amount. So there's 2 on that page. You go to page 4. Everything's looking good there on the far right, under 100% utilization. And page 5, we have one more. Oh, and there was, if you go back to 4, Tracy, just a moment. So see just a few up from the bottom, fitness choices. That would be one of those invoicing only through November that I will need to get those final numbers when I submit the final audit report to the auditors. So But going to page 5, there's another one like that right at the bottom, RTP Wisconsin, which is a big contract for us. That's Regroup. So they've only billed us through November as well. So we're definitely going to want to see the final bills on that before this 2020 is basically closed out for contracts. But over 100% utilization on that page is just a few down. Lucky Star Corporation. They're at 104%. So that's another one I've pulled. Again, it's I believe they use the CBRF. They have a lot of different homes. So I believe they use the CBRF, and that is about $5,000 overutilized. Page 6. Everything there I found under 100% utilized, but again, you know, kind of high numbers, 93% utilized at VistaCare. I'm hopeful that that's all the bills come through for that. It's a large payment every month, and obviously a very large contract. So I want to make sure we've got everything in for those total numbers, which is at 93% utilization right now. Any questions or how that works?
All right. If nobody has any other questions, we'll move on to the next agenda item, which would be our contract agreements and amendments.
So I did put a new revised document in the folder to include one new contract as well. Yes, there. So the first one, Array Behavioral Care, is simply a name change, but that's one of our really large providers. So I will let Miranda talk on that, but I just wanted to point out that this is the revised, is that Christian Servants Home was the new one that's been added. So I think Miranda's on. I don't have her. Okay, great.
Yeah. The Array Behavioral Care is Regroup Therapy. That's our psychiatric provider that is via telehealth. So again, they just had a name change, and we continue to have that service 1 8-hour a day a week. And then the Christian Servants Home is a provider that works with Children's Long-Term Support Program to allow parents to do that choice of services with providers. So they're a contract provider to work with care providers going into those homes.
So are we looking for a motion to approve Array Behavioral Health Care? Behavioral care?
Yes, please.
Okay. Then I would entertain a motion from someone to approve the name change.
I can make that motion.
A motion by Supervisor Glassbrenner. Is there a second?
I second it. Debbie Kaiser.
Seconded by Debbie Kaiser. Any further discussion? Hearing no discussion, all those in favor signify by saying aye.
Aye.
Aye. Those opposed say nay. Motion carried. And then you haven't talked about the other one yet, have you?
Nope.
Okay.
Yeah, so the Christian Servants Home works with our children's long-term support or children with disability programs to allow for parents to choose providers to go into the home. And that's funded through our children's long-term support waiver program.
And this is something that was new that we didn't approve prior for this year's budget?
That's correct. They're a new provider in the area.
Okay. Would someone be willing to make a motion to approve Christian Services? Christian Servants Home?
I make the motion to move Christian Children's Home.
A motion by Deborah Kaiser. Is there a second?
Second.
Seconded by Dr. Barris. Do you have any further discussion? Hearing no discussion, all those in favor signify by saying aye. Aye.
Aye.
Opposed? Motion carried. So we'll move on to personnel updates, agenda item number 11.
All right, there is a memo in your iPad folders for this. We hired Deborah Schwartz as a temp casual driver, escort driver for the transportation program. Deborah will start on the 15th. And we have no other, I guess, hires or personnel actions that we need to announce, other than there was a resignation of Tracy Lee. Tracy has been information and assistance specialist in the ADRC, and she resigned her position to move on to another position. And that was effective the 31st of January. I will mention that a big factor in that decision had to do with wage. We've seen a few resignations. I think I mentioned this last month, where wage was a significant factor in staff choosing to resign and move on to something else. We did have a Southwest Workforce Development Board lease staff that was hired in January. Terry Richards was hired as an LTE public health nurse to assist with the vaccines and all of the work that's being done with public health. Terry started on the 18th of January. And then I also want to notify the board that I have approved Robin Hampton to have 7 days of without pay in 2021. That is, I think there's a requirement to make sure that the board is notified of any of those approvals that are made by the department. And I should have shared my screen. I apologize, I didn't do that, but I did want to show you what we have currently for our positions, vacant positions at Health and Human Services. So we do have that information and assistance specialist position that we're currently advertising for, and I think in the process of scheduling for interviews. We continue to have 2 mental health therapist positions vacant in behavioral health that we've been struggling to fill. Those master's level positions have not been easy to recruit for. Economic support specialists, we're currently interviewing for 2 vacant positions. And the public health clinic nurse, we're currently advertising. You might recall that we changed one of our public health nurse positions to a clinic nurse position, and we had not moved forward with filling that, but we had included it in our 2021 budget. And so we're currently advertising to fill that full-time position. All other positions with Health and Human Services that are currently vacant and on our county books are currently on hold because we have not accounted for them in our budget.
Any other further questions, concerns? Hearing none. Move on to the county board member terms for the Health and Human Services Board.
All right.
So
we-
I have not gotten any official notice that Supervisor Wagner resigned from the board. I've been hearing it from multiple department heads, but nothing's come through on my tablet. So I guess it's true.
Wait,
I did reach out to Brad last week just because I wanted to make sure he wasn't having any issues with attending. You know, there's a lot of technology barriers that people have had to overcome. And I received a call from him yesterday. It was a voice message, so I didn't get a chance to talk to him. And he confirmed that he's resigned from the county board. So that is a vacant position. So just this morning, I made this note on the form that you see in front of you that shows the board member terms. I understand that it's also on the county website that his district is showing as vacant. So this board member terms, I think, do we do this once a year, Angie? I think where we just want to make sure that you know the status of the terms. Board members serve a 3-year term and can serve up to 2 terms, not counting the partial terms. So this is where all of our board members sit right now. So this would be the second 3-year term for Deborah Kaiser. Deb has served on the board for just about 6 years, and I think next month, sadly, will be your last month, Deb. Carrie Severson had
Two, Tracy. She gets March and April, and we'll have to have a new
April.
person.
Thank you for clarifying.
Yep, and then we'll have a new person in May. And
in May.
mhm.
So come for 2 months.
Thank you very much.
Carrie Severson is in the first full term right now. That does end in April, and we hope that you'll stay on for that second term, Carrie. Dr. Barris is in the first full term, having completed a partial term that ends in 2023. Ingrid Glassbrenner, because of the change from being in that citizen nurse role and now as a county board supervisor, is fulfilling a partial term of a county board supervisor. So you can stay for a really long time, Ingrid. As Cindy Ficker has begun to serve a partial term, and Supervisor Van Nelson is also filling a partial term currently.
Any other questions?
I know too, Tracy, the other reason I put this on here, because we had in the past, and I'm not sure how much this changes on with Clint now being on board, is I've ran ads leading up to the ending of a term of a citizen member. So I know Bradley Wagner will be appointed by someone on the county board, but I wasn't sure if I run the ads through Clint now, or if I first get the okay here and then go talk to Clint and then we start that process. I was a little concerned with the loss of Brad. That happened after I was already having these thoughts in my head, because that we need to start moving on this, because then it will, if we lose Brad and Debbie in the next few months and don't fill one of those, it's like only one person can be gone out of a meeting. Otherwise we won't have quorum. So it'll be really important this spring that we try to get these filled as quickly as we can. I know in the past, any citizen member, it's been kind of a lengthy, drawn out months of process to get someone appointed and approved and in here.
I believe the way that we handled that with Cindy Chicker being the most recent example is that the county administrator, I think we advertised really with the direction that interested individuals should contact the county administrator. So any of those letters of interest or application go directly to him. And then I think he took it from there. And I think what he has been doing, although it's statutorily, he appoints members to our Health and Human Services Board. I think he's consulting with the Committee on Committees as he does that. So I would propose that we contact the county administrator and just confirm that he would like us to advertise on behalf of his office.
And with that position, does it needs to be someone who's utilized or has family member that's utilized Health and Human Services
Yep.
service, right?
That's correct.
Okay.
So I wanted to maybe have people start thinking about that, and I will definitely, it's already on my list to talk with Clint about it. And I think I got a little confused because I was doing a lot of those steps for Clint. And just so I will go ahead and work with him on that. But I know it's always kind of been people were funneling ideas or pointing people that you think might qualify in the right direction to apply.
That's my opinion of the statute, at least, is that Clint's the one, now that we're at the county administrator form of government, that he's the one that appoints to the Health and Human Services Board. I guess it states that administrator does boards and commissions, and then committees are done by county board.
Okay. Thank you.
It's on my list to work with him on that. And then also, you forwarded him, you said, the Bradley Wagner resignation, or he's fully aware of that?
I don't know. I've not gotten any, only thing
Okay.
I've heard is from department heads. I've got nothing official on my email or anything that he's resigned. So this is,
And that should just happen naturally behind the scenes without this board's involvement. So hopefully that'll happen within the next month or so before we lose Debbie.
I'll reach out to Clint to make sure that he's aware of it. I believe he is, Carrie, but I will make sure.
the actual first official thing is what you guys have just mentioned here in the thing, is what first official thing, I guess, that I've heard of. Other than seeing it posted on the website and personal text messages from department heads, this is the first official thing I've heard about it. So I don't know where the ball got dropped there, but. All right. Let's move on to number 13. Approve a new transportation coordinating committee member. Should be number 3 in our packet. Summary 3.
So
Summary 2.
number 3. So this would be for the Transportation Coordinating Committee. So we always have a member from Schmidt-Woodland Hills, an employee from there that serves on our Transportation Committee as they are stakeholders for transportation. So I believe it was 2 months ago, we approved Eric Renish's resignation as he had moved on to another position. And so I'm requesting Cole Pfeifferon be approved to be on the Transportation Coordinating Committee. This was also approved by TCC yesterday.
All right. Is there a motion to accept Cole?
I can make that motion.
Motion by Ingrid Glassbrenner. Is there a second?
I second it.
All right.
You guys
I
are-
just have a discussion. I think Pfeifferon is spelt wrong, but I think it's supposed to have 2 F's in it. I don't know if that makes a difference for the official documents, but
We can.
Yeah, and that's what was supplied to me. So I'm not sure, Roxanne.
Yeah, I probably made let me look him up here.
I think he spells it a Pfefferoen.
Yeah, I probably, yep, I missed yep, it's Pfefferoen. So I missed one. Sorry about that. Thanks, Carrie.
Any further discussion? All right. All those in favor of approving Cole signify by saying aye.
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 Opposed, say nay. Motion carried. Moving on to agenda item number 14, approve a vacation extension for our Rose Cohoot.
Yeah, this is a request. You may know that the county board did approve that the county administrator can make approvals of vacation extensions for a period of time during the public health emergency. And as you can probably imagine, Rose's time has been taken up substantially trying to do all of the various things that she's doing. And because we're still going to be in the midst of covering vaccine clinics and all of the things that Rose will need to be pretty involved in, she won't have time to utilize her remaining vacation. I think June 30th was the date that the county administrator was authorized to extend vacations to. We'll still be dealing with vaccines and other kinds of public health work for sure into June. And so this is a request to follow the regular route of asking for a vacation extension that would allow Rose's vacation to be extended, I think, to August 30th. And this would have to go to the Finance and Personnel Committee to follow that route.
So a motion would be appropriate.
I'll move.
Motion by Dr. Barris, is there a second?
I can.
Debbie Kaiser, second.
Seconded by Ingrid Glassbrenner. Any discussion? Rose, I'm glad that you're willing to work and not take your vacation, but don't get too burnt out because we still need you for the long haul here.
I assume you're talking about me, and we've always got some big issues burning on the back, but they're not just simmering, they're burning on the back here. So I took that phone call, I just had to. Yeah, you know something, I don't go anywhere. I go home and do chores every night. People know me, and that's it. I started yesterday here at work at 7 o'clock. I was in the barn last night at 8 o'clock. That doesn't always happen. That's just my life. However, I am more than willing to take time off if I can get the time. That's the thing. And so if I'll do my best, I'm hoping to take a day off here in February, and I'll have 7 days left of that 10-day period from 2019 that I'm requesting an extension for. I understand that the end date for that would be June 30th, and I'll do everything I can to take the long weekends or some extra days here and there. I know that I have a family member going on vacation. They're hoping to go fishing in June, so perhaps I can finish up by using a few days that week so I can do chores for that person who won't be home. So yeah, so I appreciate your kind thoughts. Thank you.
And Rose, we are asking to extend to August 30th to give you a little more time to do that.
Thank you for that consideration. I appreciate that.
Any other discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Those opposed, say nay. Motion carried. Are we gonna do number 15 or are we gonna skip that this month?
I asked to skip it again. We'll keep it on the agenda for next month. The Finance and Personnel Committee said that they would make time for us at the next meeting to ask for some feedback and guidance from them on this item.
Wonderful. Well, this was a pretty short meeting today.
Yeah.
All right. There is no other agenda items. Motion would be appropriate to adjourn our meeting till March.
I would so move.
Motion by Supervisor Nelson. Is there a second?
Second.
I
Last
second Debbie Kaiser.
No, we'll go with Debbie Kaiser for a second. All those in favor signify by saying aye.
Aye.
Aye. Opposed, say nay. Motion carried. See you all in March.
Reminder to go reply that you approved the vouchers.
Yeah, reply back to Robin's email that you approve those vouchers.